This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. So by discarding those embryos or not putting them back and putting back what we call euploid, in other words, a normal just set of chromosomes, we reduce the miscarriage rate from that 15% I was talking about back to 2 or 3%. It doesn't totally avoid a miscarriage, but it certainly reduces it substantially. So that's where IVF fits in to the concepts around recurrent miscarriage. And I've treated lots of patients in that scenario and had great success. So if you are suffering from what we call recurrent miscarriage, a couple of miscarriages or more, we can go down that track. However, that's obviously an expensive track, and after 2 miscarriages, is it really necessary? We then go to the statistics. If you've had 2 miscarriages and you get pregnant a third time, the statistics remain the same. The 1 in 6, the 15%, is there in the third pregnancy. In other words, 80 to 85% of the next pregnancy will go forward to a baby without having to go through the IVF process. So it is a trade-off. I certainly encourage patients to carry on to try the third time before we get to the stage of doing IVF. However, there are many patients who elect to go down that track just to be a bit more certain, because a miscarriage is a traumatic moment. You wanted to be pregnant, you got pregnant, and then you lose it. I've even had a patient turn to me and say, 5 years ago I had a stillbirth. This time when I had my miscarriage at 8 weeks, it was just, I felt same emotions of loss and grief. So we do need to be mindful of the stresses that women are under when they do get pregnant and they do have a miscarriage. To that extent, I'm actually setting up a recurrent miscarriage clinic in my rooms where patients with 2 or more miscarriages can come and we can have these conversations. We're also going to provide a service whereby if you have some bleeding in early pregnancy and you're worried, you can turn up to my rooms in Montgomery Street in Cogra, and we will assess the pregnancy there and then, do a scan, do hormone levels. In most cases, we'll be reassuring, but in what we will be able to do if there is a problem is to deal with it there and then. One of the problems we have is turning up at an emergency department with that bleeding, and you'll sit there for 6 hours, get referred to the early pregnancy clinic at the public hospital, and it'll be another 4 to 6 hours before you have your scan and your blood. What we're trying to do is streamline that in our rooms in the private sector. So if you want to get involved, or if you have that problem, if you ring 9138 4222 and speak to our secretary, she'll be able to organise an appointment to see me or even one of the other doctors who works in the clinic to talk it through and be reassured, because mostly it's reassurance that we'll be offering.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.